is problem with memory, acquired problem with memory, which progresses slowly. Now, dementia has many causes. The main cause of dementia is Alzheimer's. Dementia itself is a very broad diagnosis. Like you can say heart disease, but heart disease can be many different types. Ischemic heart disease, CHF, trouble with valve, like this, right? So dementia is a problem with memory involving brain, and Alzheimer's is the most common cause. 2/3 of patients or 70% of patients with dementia, they have Alzheimer's. So that's one thing. And Parkinson's is completely different. Parkinson's is slowness of movements and tremor, but with Parkinson's, as the disease progresses, these patients also develop memory problems. But that dementia is different than Alzheimer's disease.
Please.
Does prevention help?
Yes, of course. Prevention is better than cure, they say, right? But here,
Prevention.
pardon?
Prevention. The
Medication.
drug. Yeah, medicine.
Which medicine?
Prevention.
Prevision.
Prevention.
Oh, medicine called prevision.
Prevention.
No, the medicine name.
The
Medicine name is.
I'm not sure about that medication. We don't use it. Maybe it's
Right.
with a different name in different countries.
Marasa. I'll come to all of you.
What blood test can be performed to find out the?
There's no blood test which can lead to diagnosis of dementia. It's by history and physical examination, talking to the family members. Blood tests are only done to rule out any other issues which can lead to dementia, such as B12, liver function, or kidney function, and those things.
Sushila, I'll come to you. Sushila.
What are warning signs for family member to know that we should take him or her to the doctor or some treatment?
Unusual behaviors, right? Misplacing things very often, repeating same question again and again, right? Or behavioral changes.
Sister Abda.
Yeah, Assalamualaikum. I have problem with forgetting names, and my mind is just stuck in that. And when I remember that, so I'm so grateful to Allah that I remembered it finally. So is there anything helpful with the diet and physical fitness?
Exercise is very important. Physical exercise, mental exercises such as word searches, mental yoga, doing more cognitive activity. If you learned some surah before, revising them and learning new things. I had a patient once. He was from somewhere from Mississauga. I forgot now. He was 67. He retired and he memorized whole Quran in 10 months.
Sister. Yes.
What are the causes of Parkinson's?
Parkinson's, we don't know the cause for Parkinson's, the real cause for Parkinson's. We have some associations with Parkinson's. For example, the pesticides. People who live in rural area, they use pesticides. They have with higher incidence, or if they drink well water, they have higher incidence of Parkinson's. But we don't know the exact cause for Parkinson's.
Dementia and Parkinson's are both related.
Patients with Parkinson's, as it progresses, they do develop dementia.
Yes, ma'am. Young man.
Hello, bless you, Dr. Rana and seniors. So my wife's father has Parkinson's. He was diagnosed about 4 or 5 years ago. So what's the process if they want to get a consultation with your office?
Yeah, usually the family doctor, or if there are two types of neurologists. There are general neurologists, and those neurologists will deal with one disease. I deal with Parkinson's. So if they are seeing a neurologist, then they will make a referral. If they are a family doctor, if there's a family doctor, they will make a referral, and then we give the appointment.
Sister. Yes.
Because we are not stressing our mind as much as we used to before. Like we are using GPS for contacts, we are using the phone numbers, we're not trying to remember it. Are you noticing that forgetfulness is more now than it was ever before?
I think these neurodegenerative diseases, like I can speak on Parkinson's, that the incidence of Parkinson's will become double. The number of cases of Parkinson's will double by 2040. That's what we believe, right?
It's increasing.
Yes, increasing. It looks like dementia is also increasing. One of the cause of this is aging, because we're treating high blood pressure, we're treating diabetes now, right? the safety regulations, so people are aging more and more, so these neurodegenerative diseases are also increasing because of this. Of course, the cognitive activity, if it is less, it would predispose people more towards dementia.
You have the question?
Sorry, there is a recent treatment, I think it's more popular in the US, which is brain surgery. So what is your quick thoughts on that, treating some of these Parkinson's, other related diseases?
For dementia, there's no brain surgery, but for Parkinson's, in refractory cases, in cases where with medications, we cannot control some of the symptoms. So in selected number of patients, we do brain surgery and it is helpful. But not every patient is a candidate.
By using so many medicines for other diseases can cause these kind of issues, dementia or Alzheimer.
There are certain medications which can make you feel dopey or slow, but the medication so far, we don't know there's a definite link that medications cause dementia. For example, there are medications like amitriptyline, which we use for pain, right? That can lead to some of the cognitive slowing and those things, but not that medications cause this.
Yes, excuse me. For loss of memory, the early warning sign is you forget in your namaz. So, is it true?
Forgetfulness in day-to-day activities, especially the short term, that is the early sign. Forgetting in salah or namaz is very common complaint, right, of people. What I kind of, what is my observation that when you read salah, every rakat, read a different surah which you don't read it often, then you remember it. If you read the same surah again and again, then it becomes a routine. That's what I found out for mine, because I forget in salah sometimes too, right? So.
Memorizing and reading salah is it's easier to memorize Quran.
Right,
Yeah.
right. So it's a very common complaint, and of course, this is an indication for future.
What is the prevention measures?
Prevention is, as I said, that applies to dementia, like staying physically active, cognitively controlling diabetes, high blood pressure, high cholesterol, controlling your weight, changing your diet. These things are very important.
Any dietary supplement is
Dietary supplement, vitamin B12 is a commonly used dietary supplement.
What about
Patients.
vitamin D?
Vitamin D is very
so much
important.
recommended these
Yes,
days.
vitamin D is important for bone health and health.
Yes, sister.
The lack of sleep.
A lack of sleep, I don't know, but of course, if you don't sleep a few days, it's right? But I don't know who has persistent lack of sleep, of course.
People sleep like 4 hours a day.
Yes. I sleep about 4 or 5 hours a day.
I have a question. I have an issue every time there is a salah with more than 2 rakats, 3 or 4 rakats. I tend to forget. Is there any solution? Is there any way we can remember how many rakats we have performed?
What I did for myself,
Yes.
there are some surah which we read commonly, some uncommonly, right? So I read the uncommonly surah in the long namaz, like Zohor or Isha or Asr. So it helps me to say that, I read that surah in the first rakat, and second, it helps me to memorize. And also what I do is that every day I remember 1 or 2 new ayat, and then I read them in salah. So that helps me to remember. Yes.
Yes, you are.
Sorry, inshallah, last question. Actually, you mentioned one thing which is about learning, the importance of learning new things. And I think you mentioned physical activity, staying active. So, we see Walmart, for example, they hire seniors in the front to greet people, and then you see, mashallah, Allah Mubarak, our seniors who are teaching Quran, getting involved in masjid. So what are some quick ways to stay active? Because obviously job opportunities may not be as, people who are senior, they will prefer to work part-time. What's your quick thoughts on that?
Changing our food.
Yeah.
That's very, very important. So, intermittent fasting for 15 hours is extremely helpful to reduce your weight. Diabetes can be cured by this, right? cutting down belly, right? That's very, very important. Eliminating carbs from diet, having more protein in diet, and continue working as long as you can work. Retirement is not necessary. You don't have to retire, right? There's no concept of retirement like in our business. Yes.
Well, Dr. Saab, let me ask a question. I remember that in one of our sessions, you have suggested some typical exercises to overcome these issues of Alzheimer's. You can tell them what are those exercises?
For the physical exercises, we have compiled this booklet for, these are 45 exercises.
Yes.
So they are available free. We have printed. I wish I could have bring it with me. I didn't bring it.
Yeah,
send it to
okay,
you
okay.
and
I know.
to the civic club.
So please tell
Yeah.
them what are
So these are stretching exercises. They involve most of the joints. You can do without any machine, at your home. Right, and every senior can do it, so I'll try to send that booklet, several copies to Mr.
Actually, it's shown there are a lot of exercises to do with your walking and seeing anything. Very interesting ones.
Yes.
Yeah.
These are,
Yeah.
yeah, so these are 45 exercises which I compiled, and we recommend every Parkinson patient, even people who don't have Parkinson, they can do that too, and we have seen extremely, excellent results with these patients.
I guess after 4 exercises, you'll forget how many you've done.
No, it has a log with it, it has picture, it has number of repetition, and each booklet is for 1 month.
Oh,
So we did you put everyday time and the number of repetition you do it. It's a log book like log. It's not just that do these exercises. And this exercise diary is used in about I think 50, 60 countries. Wherever I travel, people have it. Every Parkinson's clinic has it.
How do you diagnose Joe Biden?
With a privacy law. You can't disclose. Well,
I've not seen him as a patient.
right.
Yes.
Doctor, thank you very much. I know. Let me tell you, besides that,